Obstetric lacerations are common in childbirth, affecting 70 to 90% of all vaginal deliveries. For medical students and residents seeing perineal lacerations for the first time, it is often difficult to understand perineal anatomy and the surgical techniques that underlie an obstetric laceration repair. Educators have previously developed low and high fidelity perineal models to simulate obstetric lacerations. However, these and most other simulation models require educators to obtain building materials and construct the models prior to their use, which preclude their routine usage. There is a need for a low-cost, easily accessible, three-dimensional model as an educational tool for obstetric laceration repair, especially for use on labor and delivery units where these lacerations occur. In this video, we introduce the paper perineum model, a paper model that can be printed, cut, and folded into a three-dimensional shape representing the vagina, perineum, and anal sphincter complex. We believe this low-fidelity model overcomes several limitations of prior models and may be a useful tool for educators. After watching this video, educators will be able to understand how to obtain, print, and assemble the paper perineum model. Educators will also learn how to apply the paper perineum model to teach anatomy relevant to obstetric laceration repair, to simulate different types of obstetric lacerations and episiotomies, and to demonstrate surgical techniques integral to obstetric laceration repair. The paper perineum model requires minimal materials for construction. These materials are an inkjet or laser printer, letter paper, scissors, and a stapler with staples, or tape. The paper perineum model template can be accessed at this link, which is also listed in the video description, or by scanning the QR code in the bottom left of this video. If provided printer options, choose Print to Fit or a similar option to maximize the size of the template on the printable paper area. Instructions for model assembly are provided at the top left of the model template. First, cut the template along the thick black lines marked with the scissors. Next, fold the template along the dashed line while keeping the template facing outwards. The top edge of the paper should align with the cut edge from the previous step. Then, overlap tab A and tab B to form a tube. This forms the vaginal portion of the model. Staple tab A and tab B together at the two areas marked by the staplers. Alternatively, tape can be used. Finally, fold the template at the junction between the newly formed tube and the remainder of the model in the orientation as shown. The assembled paper perineum model can be used by educators to teach relevant anatomic structures for obstetric laceration repair. This includes the perpendicular interface between the vaginal canal and perineum, the position of the hymen as a landmark for the transition between the vaginal epithelium and perineal skin, and the composition of the perineal body, which contains contributions from the bulbospongiosus, superficial transverse perineal, and external anal sphincter muscles. Educators can also use the paper perineum model to simulate different types of obstetric lacerations by excising different portions of the model. To simulate a perineal laceration, completely fold the assembled model along the dotted line. Cut out a triangular strip at this junction, then unfold the model. Note the creation of a diamond shape representing a second-degree perineal laceration. This simulated laceration contains both vaginal and perineal components in three-dimensional form. The laceration can be extended into the vagina to simulate deep vaginal sulcal lacerations, as shown in this example. It can also be extended towards the anus to simulate third and fourth degree perineal lacerations, as shown in this example. Furthermore, the model can be used to simulate different types of episiotomies, such as a medial episiotomy, a mediolateral episiotomy, or a modified mediolateral episiotomy. With this, learners may appreciate how extensions of medial episiotomies are more likely to result in anal sphincter injuries compared to extensions of mediolateral episiotomies. While the paper perineum model is a low-fidelity model and is not intended to be used for hands-on repair, its three-dimensional depiction of perineal anatomy and obstetric lacerations is useful for teaching basic surgical concepts integral to obstetric laceration repair. In this example, with a simulated second-degree perineal laceration, a point approximately 1 centimeter cephalad to the apex of the vaginal portion is marked as the appropriate location to start the laceration repair. In a constructed model, learners can appreciate how an apex that is more cephalad may be associated with decreased visualization and a more challenging surgical approach. The model can also be used to teach the orientation and path of the needle for vaginal and perineal components of a laceration repair. In this example, the model is used to demonstrate how a needle should enter normal to the plane of the tissue. The orientation of the needle should be perpendicular to the cut edge of the laceration to ensure appropriate apposition of the laceration edges once tension is applied to the suture. This may require the surgeon to change the orientation of the needle between right and left sides of the laceration. In this example, the model is used to demonstrate differences in suture path between vaginal and perineal portions of laceration repairs. In the vaginal portion, the suture path is in the axial plane. In the perineal portion, the suture path is in the coronal plane. A crown stitch, often performed as the transitional stitch between the vaginal and perineal portions of a laceration repair, can be demonstrated as a stitch involving a suture path in the mid-sagittal plane. We have found the paper perineum model to be a helpful tool for medical student and resident education, especially on the floor of labor and delivery units where these lacerations occur. Moving forward, we plan to conduct validation studies for this educational model. In conclusion, the paper perineum model is a low-cost and accessible three-dimensional model that can be used by educators to teach anatomic and surgical fundamentals pertinent to obstetric laceration repair. We thank you for your attention and welcome any questions or feedback regarding the model.